welcome you back. Hopefully you've already watched my first video explaining why most people with chronic health problems never get better and what makes our office different from most functional medicine doctors' offices or integrative doctors that you've worked with. The reason I put this second video together is really that I realized that most of what we do, the process of becoming a patient and really working with us, is very, very different than what you're already familiar with. And so in this short video, you're going to learn a little bit more about my case review and why you should consider it if you're serious about getting to the root cause of your health problem. Now, the case review, whether you're doing a comprehensive case review or because you have multiple health problems and really you have a complex case, or you're doing the low complexity case review, this is the starting point for every prospective patient. This is really how you establish a doctor-patient relationship with our practice. I also want to reiterate that all of the paperwork, the new patient paperwork that is completed, is sent to our office prior to your appointment. And this is the information that we will spend anywhere between 60 to 90 minutes reviewing, digesting, dissecting, and reviewing prior to that appointment. If you purchase a comprehensive case review, there are 7 parts of your new patient application. And if you're serious about becoming a patient and working with my office, I want you to pay special attention and close attention to what these 7 parts are so you know what to expect, right? I'll tell you what those are, and then I'll explain them in much more detail and why they're so important for your case. Because this is really the information that begins to help us understand your big picture. These 7 parts are your health narrative, your 7-day food journal, your metabolic assessment form and neurological assessment forms, your medication and supplement intake forms, your past medical testing. And so what we'll do is we'll just spend a few minutes going through each of these and really how these are different. And so the first piece of this is your health narrative, right? This health narrative is a 3 to 5 page typed up health history that gives you the chance of really telling me everything and anything you want me to know about your case, right? This could be, for example, your deepest, most troublesome secrets that can be sometimes challenging emotionally and difficult to articulate or verbalize or share face-to-face with a doctor. Or they may be things that you've tried unsuccessfully. What I find is that if you felt rushed during your doctor's visit, or you forgot to tell your doctor something that you felt was important, this is the place that the health narrative can allow you that ability and that opportunity to share that information. The things you share with me in this health information are often forgotten. They're often overlooked when you are sitting in a traditional doctor's office waiting for the doctor. And so essentially, again, this is where I get to hear from you. This is your chance to tell me everything you want me to know about your case or your loved one's case. This is where I get a chance to know a little bit more about you, who you are, and sometimes it's these things that provide the details that help us understand where you need help. And sometimes these are things that just don't show up on testing, right? So again, these are the things that could really help provide insight into the required testing in order to help you understand where we can best help you. The second part of your new patient report is the 7-day food journal. This is where I want you to share with me everything that essentially went into your mouth in the last 7 days, right? Don't impress me here. You're not being judged. Simply write down everything that you eat and everything that you've snacked on during the last 7 days. This is where essentially I get to see what you eat and also what you don't eat, and perhaps some of the testing we may need to run pertaining to the things like nutritional deficiencies or food sensitivities or food allergies and intolerances. Right? Don't change your diet during this period of time, because this will not be a good representation or a good reflection of what your diet has been that's kind of led up to this. Right? So don't start a new diet or start eliminating foods during these 7 days. The third and fourth section of my new patient paperwork is what is known as the metabolic and neurological assessment forms. Now, these assessment forms have 19 different categories with various symptoms ranging from gut health to gut absorption, to things like blood sugar handling, to sex hormone imbalances, to adrenal problems, to liver function, to mucosal intolerance, to the potential for symptoms related to leaky gut, or things like chemical sensitivity, or thyroid problems, or toxicity, right? Each of these 7 or 10, each of these categories, I should say, has 7 or 10 different symptoms within that numbered category. And next to each symptom, there's a 0, 1, 2, or 3. And so it's really simple. You just go through each one of those symptoms and you circle 0, 1, 2, or 3, depending on how frequently or how severe the symptoms you're experiencing are. The neurological assessment form follows the same format, but is now designed to understand more of the mental and emotional side of these symptoms. These assessment forms are really tools to help me understand and get a better idea or a better understanding on how these symptoms are intertwined and how they're interconnected to various systems of your body. Now, the fifth section of the paperwork includes a section for you to list all the medications that you're taking, all the supplements that you're taking, and of course whether or not there's any side effects that you may have experienced from them. And that's important because a lot of times when a person is taking multiple medications, certain medications can cause symptoms. And obviously we want to know what medications you might be taking that might be contributing to the symptoms that you're experiencing. Okay. Now the sixth and seventh section includes a review of your past medical history and the review of past testing. If you've had blood work done in the last 6 or 12 months, then of course I'll want to review that. There might be things that your past doctor may have missed. All right. The new patient application is some of the most comprehensive paperwork that you have ever filled out. I'll almost guarantee that you've never had a doctor spend the amount of time reviewing your records in this approach, in this fashion. And because it takes time to review this, unfortunately, this is also the reason why we limit the number of patients that we work with on any given month. Right? A lot of time goes into reviewing each patient's records and files and putting together reports. And for this reason, this is the primary reason why we have such an incredible success rate in helping patients with chronic health problems. And again, these are going to be patients that suffer with things like depression and thyroid problems, diabetes, autism, Hashimoto's disease, inflammatory bowel disorders, chronic fatigue syndrome, brain fog, and really any number of health problems that you see listed on my website that we can help. Right? We live in a world that for every effect there is a cause, and if we can find out what your cause is, we will help you get on the right track and feel good, and we'll help you do this naturally by supporting your body. When it comes to testing, whether we look at blood testing or stool testing, saliva testing, urine testing, or breath testing, these tests will be tailored to the individual concerns that you have, and from the assessment that we do and how we look at this big picture, and of course what your goals are. One thing I will tell you is that I do not have a cookie cutter treatment plan or a cookie cutter approach for every patient that has a diagnosis or let's say certain symptoms or thyroid disease or depression or stomach pain. And that's why I do the case review. So let me give you an example here of what I mean when I say this. All right? Let's say you experience chronic fatigue, and this fatigue really could be due to a number of things. Right? In one person, it might be caused by a thyroid problem. In another person, this fatigue might be caused by Lyme disease. In another person, it might be fluctuating problems with their blood sugar. Blood sugar is going up and down. In another person, it might be due to heavy menstrual cycles and a loss of blood during that menstrual cycle. It might be due to internal bleeding. The fatigue might be coming from a gut infection or a heavy metal toxicity. The fatigue might be coming from mold exposure or nutritional imbalances. You see, chances are there are many, many causes for the symptoms that you're experiencing. And only after I review your case and understand how some of these symptoms might be connected and intertwined can identify how I want to approach your health problems. You know, this is the approach that has taken me over 20 years of experience to really develop. And this is what I call the big picture. And when you have a chronic health problem, each and every one of us has a unique big picture of why we're sick and how we got sick and really why we continue to have these flare-ups. My job is to really understand what your big picture is and how that's all connected. The last thing I want to do and cover in this video is really what you need to do if you're really ready to get well and get started. Right? The process of getting started with the case review is very straightforward and it's very simple. And it's the same for patients in the USA as it is for our international patients. So the first step is, number one, is purchase a case review. Again, whether you purchase a comprehensive case review, our signature program, or you purchase a low complexity case review, again, this is the first step. This is the case review that you can see on our service tab. Right? Step two is once you purchase, again, either this high complexity or low complexity, you're going to get an email with several file attachments. And this is the new patient application, right? What you're going to want to do is you're going to want to print this new patient application up. You're going to want to follow the instructions in that email. Make sure that each page requires a signature. Make sure that it's been signed and that you've gone through the checklist included with that new patient packet. Step 3, and this is very important, either mail your new patient application back to the office, or if you have a scanner, scan the entire new patient application and email it back to our office. Now, one thing I want you to be aware of is that the new patient paperwork is processed in the order that it's received. So some patients want to expedite this appointment if you're looking to get an appointment sooner. I suggest you either overnight the paperwork or you scan it into your computer and then you email it back to our office. Once I've reviewed your new patient application, one of my new patient care coordinators will contact you through email and they will provide you with upcoming dates of availability for that case review. That's how simple it is. All right. Now, one question that my team has often emailed when it comes to really just getting started that I want to address in this video is the question is, how much is all of this testing going to cost me? And so one thing I will say is that when it comes to testing, testing varies from person to person to person. Again, if you watch my first video, then you know that we don't have a cookie cutter approach to how we're going to approach your case. And it's not until I review your case that I know how I want to tackle these problems to get a better feel and an understanding of where these problems are originating. I have no idea what testing is going to cost you. Much of this, again, like I said, is going to be based on the complexity of your case, the kinds of tests that we need to run, the kinds of testing that has already been done, how recent your past testing is, and how in depth we need to get in order to understand how to support your body. Now, I hope this video helps you understand the process of getting started, what we do, how serious we take your health. And in the next video, which is going to be titled Your Report of Findings, I'll explain exactly what happens after we get your test results and how we approach the recommendations and what we discuss during that report. Hope to see you there. Take care.